Starting and growing a healthcare practice includes a wide variety of skills. These days, you need to know about computer networks and software technology and the reasonable safeguards to keep health information secure and your healthcare practice efficient. In this episode, I'm going to help you with your newsletter online subscription practices, the information that you need to know to make good decisions to protect your healthcare practice. This is Jean Eaton, your practical privacy coach and practice management mentor with Information Managers. Now, just a reminder, I'm not a lawyer and I don't play one on TV. These are my recommendations based on my experience and research and not legal advice. About sending newsletters to our patients. What should we know about that? Well, using a newsletter to reach your patients and their family and friends and your referral partners to your healthcare practice is a great way to keep in touch with them using a different way to be able to communicate with them. So having a newsletter gives you the opportunity to share with your audience useful tips and education topics that will help them to maintain and improve their health. It also gives you the opportunity to share what you want your practice to be known for. So you can spotlight your friendly staff and your providers, your convenient services, or the extra services that are available at your practice. Now, you can do this in many different ways. You can print a hard copy newsletter to share with patients in your waiting room. You can also share an electronic version by using email from your website, or even share using your social media accounts. You can increase your engagement and education with newsletters, but I want to make some recommendations here to help you manage that securely. When you're using an email newsletter system, we want to be clear about how those emails are going to be collected and how it's going to be used. So very specifically, we want to make sure that we are collecting emails for patients to receive a newsletter, that it's an entirely separate process than what we may be collecting emails for in our EMR system. So when you are providing a healthcare service and you might be collecting email for a healthcare service purpose, perhaps like appointment reminders or online appointment booking, you want to record that in your EMR or in your paper record, but you want to have that in a very specific way so that you know that you've collected that email for the purpose of providing that healthcare service. So you need to make sure that you've consented the patient, that they're informed, and if you need some examples about how to design that consent process for healthcare, take a look at our article about texting with patients, and there is a sample email consent form in there. When you're collecting information from patients and collecting their email address, make sure that they are using their personal email and not a work-related email address. So if you are collecting healthcare or emails for a healthcare purpose, and then you decide that you're going to send everybody an email for a newsletter, that's a violation of the Health Information Act. And you can actually be fined for up to $50,000 per occurrence when you've used that information that you collected for a healthcare purpose for a non-healthcare purpose. So anything that is marketing is anything that is not healthcare. So some people may say, well, the newsletter is for education information. Well, that's great, but it's not a health service. So it falls under the category of marketing, and that is a violation under the Health Information Act. So to prevent problems, I strongly recommend that you have two separate databases, one for your healthcare service and one for your newsletter. So that database that you manage for your newsletter is completely separate process from your registering patients for a healthcare purpose. So use a separate, different database for that. Now, there are a lot of ways that you can do this, and there's some great autoresponder services or email services that you can use that will manage the emails for your patients and the families and friends who want to receive your newsletters. So you can use a service like Campaigner or MailChimp or a variety of other autoresponder services. So this collection and use is authorized under PIPA legislation, the Personal Information and Protection and Privacy Act, under under Section 7, Sub 1, with the appropriate consent form. So you need to be very clear about what emails that you're collecting. So you're going to keep the healthcare email separate from that newsletter email. So I want to share with you a couple of steps about using an autoresponder system that you can discuss with a vendor who is going to help you do this. So you might do this in-house. You might hire a social media manager or consultant to work with you to do this. But here are the key steps that you want to keep in mind. So when the patient comes to the clinic, I suggest that you get them to actually sign up themselves on their own device or on a tablet that you might have available at the clinic. So the patient signs up at the clinic on the autoresponder system themselves. So it doesn't take your staff time any additional time. And the patients can add their own email address. They're responsible for entering it in properly. And quite frankly, people like the glitz of having a tablet. So if they see somebody else using a tablet in their waiting room, they want to find out what they're signing up for as well. So it actually might help to encourage some signups in your practice. So you get the patient to sign up on the clinic website or on a website that's hosted by your autoresponder. So you don't have to have a website for your clinic to do this. It makes it a little bit easier, but it's not the only way that you need to do it. So you give the patient the address to, or the URL address to go to enter the email address. And in that confirmation opt-in box, it'll be some instructions about what are they signing up for. It's a newsletter at your clinic. You're going to get it quarterly or once a month. And what is that newsletter going to include? Then they're going to opt in, and they'll use the opt-in form from the autoresponder. Now, the autoresponder will also send them an email confirmation. Now, all autoresponders will give you the option to do this, and this is the way I suggest that you do it, is that you have them actually go to their email inbox to confirm they have received that email that confirms that they've signed up for the newsletter. And you can give them the first newsletter or the most recent newsletter right away. Now, on your opt-in form, on your web page or on your autoresponder, you want to have some wording, something like this. Please enter your name and email to receive ABC Clinic newsletter. What are you going to receive? How often are you going to get it? And a specific checkbox that they have to click on to make sure that they've consented to receive those emails. And let them know that they can unsubscribe at any time. You should also have links to your privacy notice and new terms of condition on your website. That's why I like having this on your website rather than just on your autoresponder. It gives it a little bit more robustness, but there are lots of different ways to be able to do this. Now, something I want to bring to your attention here is that in this opt-in box that I've mocked up here for you, I've given the first name and the email address. I haven't asked for the last name. You really don't need the last name to be able to send somebody a newsletter by email. And I particularly don't want it on my autoresponders for the clinic for the newsletter because I don't want to be tempted that I can do the data matching from your EMR system to your separate social media newsletter database. And if I'm the patient, and if I've only entered my first name, I'm perhaps feeling a little bit more confident that somebody at the clinic isn't actually going to take a look at my EMR information because they've got my first name and address. It just helps keep this whole two concepts entirely separate. So here's another option for an opt-in form. Looks very similar. Again, I prefer not to use that last name. In your autoresponder confirmation, you can set it up so it says, thanks very much for signing up for this newsletter. We want to make sure that we've confirmed. Please press this button. And then you can send them the most recent newsletter. So if you've just sent your newsletter for this month and they've signed up 2 days later, you can say, here's our most recent newsletter. And that's something that you can set up in what's called the RSS feed for your autoresponder. Again, I'm not going to get into the details about how to do that, but I want to give you the terms so that you can contact your social media advisor to help you get them set up. Now, if you would like more information about how to set up autoresponders, I'd love to hear from you. Let me know in the comments that you'd like some more training for autoresponders, and we can do that in 2019. So here are some quick tips to protect your list. Make sure that you have a separate database for your healthcare service and your newsletter systems. Make sure that your opt-in form allows for good information about what they are going to receive and that they've consented to receive it. I strongly recommend that you use an autoresponder system rather than trying to set up something on your Outlook email or your Excel spreadsheets. Autoresponder systems don't cost a lot. Many of them are free, and they make your work much more efficient. Make sure that you have a written social media policy in your practice. If you don't, let me know that that's something that you need and that's something that's available in your Practice Management Success membership. Now, also remember that if you have a vendor who is going to help you with your social media practice and managing your accounts, first of all, as a business, you should own your autoresponder account. So if you go with MailChimp or Campaign or Wishlist or a variety of other autoresponders, create the account in your business name and then give the shared authorized access to that external social media manager. So if that external vendor leaves for whatever purpose, they haven't taken your database with them, you've got it under your control. And if you have a falling out with that vendor for any reason, then you can reduce or take away that access to the database. So the business should hold that account, even if you've hired somebody else to manage it for you externally. And if you're doing that, you need to have a VNDA that is compliant with PIPA legislation, which includes privacy breach mandatory reporting under PIPA legislation. So make sure that you have a robust agreement with them. So a couple more social media tips. I share social media messages on my social media accounts, and I share other clinics' social media messages that are really great examples about how you can use Facebook or Twitter or LinkedIn to be able to share your social media message. So you can follow the hashtag social media healthcare, and that's where I retweet or reshare other clinics' good examples about how they use social media. Now, in Practice Management Success membership, we also talk about a variety of social media resources, tips, tools, and training, so you can follow that as well. This is Jean Eaton, your practice management mentor and practical privacy coach. If you like this episode, please subscribe to this channel and add your honest feedback to the comments below, so that people who like what you like can find this podcast.